Hi, very good evening. So it's been quite a while since we had a live session on a whiteboard. So today we'll have one point and shoot session on the topic trachea. I posted few multiple choice questions, different types of questions pertaining to the topic. I hope you have gone through them. We'll briefly go through all those questions and related information as quickly as possible, right? So once again, a very good evening all of you. Hi Kriti, Vyas, Mubashira, Richa, Avasti, Hina, Preetu, Pragati, Kanchan, Jaspreet. Hi, a very good evening. So we'll right away proceed into our today's discussion, the topic trachea from anatomy, the windpipe. So we'll quickly go through the questions and then discuss the related information. The first one, trachea is, we have four options: collapsible and closed, non-collapsible and closed, collapsible and patent, non-collapsible and patent. So which is more appropriate pertaining to trachea, or also called as windpipe? As you know, it's commonly called as windpipe. It has specific dimensions. It begins from, or it marks the beginning of the respiratory tract, isn't it? It starts from the cricoid cartilage at the level of the body of C6 cervical vertebrae. So which of the following options is more closely related or more appropriate pertaining to trachea? Very good. It's non-collapsible, exactly, non-collapsible and patent, because of presence of C-shaped tracheal rings. So it's non-collapsible and patent. And you said C-shaped cartilaginous rings. They're C-shaped. So we have a related question pertaining to that. Let's go through it. So option D is right answer. Wonderful. So second question pertaining to cartilaginous rings. Cartilaginous rings surrounding the wall of trachea are not continuous posteriorly in order to allow expansion of esophagus. Is it true or false? Cartilaginous rings surrounding the wall of trachea are not continuous posteriorly to allow expansion of esophagus. True or false? So we say C-shaped tracheal rings. They are C-shaped because they are not continuous posteriorly. So why do you think they are not continuous? To allow expansion of esophagus during passage of food. So the given statement is true. Cartilaginous rings surrounding the wall of trachea are not continuous posteriorly to allow expansion of esophagus. It's a true statement. Wonderful. Okay, let's move on to the third question pertaining to dimensions, purely memory based. But we have a catch here. I mentioned the age of the patient also. The length, external, internal diameter of trachea in a 12-year-old male patient. So what are the dimensions of trachea? So normally the dimensions, length usually varies. We have specific dimensions for length. The external diameter also varies depending upon the sex. It's different in males and females. And the lumen diameter or the internal diameter varies according to age. So what could be the dimensions of trachea in a 12-year-old male patient? I'll let you know why I mentioned the age in specific. Yes, Vyas, Akriti, Preetu, fantastic. So the length ranges from 10 to 15 centimeters. Whereas the external diameter, as Akriti rightly pointed out, it's 2.5 or 2 centimeters approximately in case of males and 1.5 centimeters in females. And the internal diameter or the dimension of lumen, it's around 3 mm at the age of 1 year, and then it increases corresponding to the age during childhood, and the internal lumen is maximal at puberty at around 12 years or 13 years of age, where the maximal dimension of the lumen is 12 mm. So the internal diameter of the lumen is 12 mm, which is the max seen in puberty, right? And as I said, at age of 1, the lumen is very narrow. It's around 3 mm, and then it increases corresponding to the age of the patient during childhood. So it will be 10 to 15 centimeters length, external diameter 2 versus 1.5 depending on sex, and lumen depending on the age, right? So this is very, very important. And one related question, what do you think is the diameter of lumen in living individuals compared to cadavers? In whom do you think the diameter of lumen is less or more comparatively? When you compare a living person to a cadaver, in whom do you see lesser diameter of lumen? Exactly. It's smaller in case of living individuals, maybe because of muscular activity and all. And as we discussed previously, C-shaped tracheal rings, they are incomplete posteriorly, and the posterior wall of trachea is made of fibrous tissue and trachealis muscle, right? So the lumen is wider in case of cadavers compared to living individuals. Fantastic. Now let's move to penultimate question. It's related to the boundaries of trachea. The boundaries are always important, right? Whenever we're going across any topic in anatomy. Inferior thyroid veins and recurrent laryngeal nerve form dash boundary of trachea. Inferior thyroid veins and recurrent laryngeal nerve form dash boundary of trachea. Anterior, posterior, anterior and posterior respectively, posterior and anterior respectively. In fact, I've shared all these MCQs in Google group, notes in WhatsApp update group, including YouTube, right? So you can get the soft copies from these sources. So the inferior thyroid veins and recurrent laryngeal nerve form dash boundaries of trachea, anterior, posterior, anterior and posterior respectively, or posterior and anterior respectively. So which option do you think is more appropriate? So the boundaries of any anatomic structure are very important. Exactly, it's anterior and posterior respectively. Okay, can you name some anterior boundaries? Option C is right answer. Can you name some anterior boundaries of trachea? Anterior boundaries of trachea. I'll start with one. Isthmus of thyroid gland, which occupies the second and third tracheal rings. Can you name any other anterior boundaries of trachea? Exactly. Isthmus, inferior thyroid arteries, pretracheal fascia surrounding the thyroid gland and inferior thyroid artery, sternocleidomastoid, sternothyroid muscles, wonderful, sternohyoid and sternothyroid group of muscles, investing layer of deep cervical fascia, and suprasternal space, and skin and superficial fascia. So these are the anterior boundaries of trachea. And what about posterior boundaries? Wonderful. All the strap muscles, exactly, form the anterior boundaries. What about the posterior boundaries of trachea? Exactly. Esophagus is one structure, and one in the option, recurrent laryngeal nerve, which is present in tracheo-gingival groove, and one muscle. Can you name that muscle? In fact, we have a cross-sectional image of the entire description which I am giving, which I have posted in e-classes. You can refer 1 minute video esophagus which I have posted today in e-classes. You will find that image and relevant discussion. Yes, longus colli muscle and recurrent laryngeal nerve. So posteriorly you have esophagus, longus colli muscle and recurrent laryngeal nerve. In fact, it supplies parasympathetic innervation through vagus to trachea. Wonderful. So option C is right answer, right? So the sensory, secretomotor and motor fibers are supplied through recurrent laryngeal nerve originating from vagus, right? Now moving on to the final question. Arterial supply of trachea is derived from superior thyroid arteries, inferior thyroid arteries, both, none. So what is the arterial supply of trachea? Branches of inferior thyroid artery. Good. What about venous drainage? All the veins drain into which major vein? Venous drainage of trachea. And finally, lymphatic drainage. Exactly, venous drainage, all veins drain to left brachiocephalic vein. Left brachiocephalic vein. Lymphatic drainage into lymph nodes present. Yeah, good. Pretracheal and paratracheal. Exactly, pretracheal and paratracheal group of lymph nodes. Fine. So that's pertaining to the blood supply. So option B is right answer. So this is in brief the entire trachea, the cervical part of trachea which we need to focus on, head and neck, volume 3. So I think we've covered almost all the topics pertaining to cervical part of trachea, including innervation, boundaries, dimensions and the root. Fine? I hope it's clear. So we'll definitely incorporate these kind of sessions alternate week or once in a while so that we can have this perspective of studying a particular topic through MCQs, which will definitely be much more interesting. I hope you enjoyed this session and I'm sure we're concluding it very fast, right? It's been almost 16 minutes. So we'll keep our live sessions very brief, crisp and clear. Fine? I hope you enjoyed this session and you have any further queries, you are always free to mail at proudtobedentist@gmail.com. Fine? So wish you all the best, love you all, and before I conclude, I posted one video in specific regarding circadian rhythm, in specific regarding how to improve your memory and intellectual performance. I posted it just very recently, I think yesterday. Do go through that video. I discussed many key elements which are relevant for us in our day-to-day activities. What's the importance of being a morning active learner rather than a night owl? How being a night owl is going to affect your memory, right? So I've discussed all this range of issues in that specific video. You can go through it and make most use of it, right? So wish you all the best. Love you all and see you again in another live session, and we'll keep you updated in our Google group and WhatsApp update group. Fine? Yeah, glad to hear that. So keep momentum going. It's all about working hard and giving your best. There is no shortcut. Just pure hard work and determination. Just give your best. It's hard work and consistency. Believe in yourself. Fine? So love you all. Take care. Bye.